My plaque disappeared in just 90 days. If you look here at this ultrasound, this is a picture of my carotid ultrasound. The carotid artery is a blood vessel that goes up from the body through the neck into the brain and supplies all the blood flow there. Cardiac disease, heart disease, stroke. This is the #1 global killer. In the US alone, 800,000 people get a heart attack every year. For half of them, it's the first time that they find out that they have heart disease. I just had my carotid ultrasound done a few days ago, and I asked the ultrasonographer, have you ever heard of anybody reversing the plaque in the carotids? Have you seen plaque reverse in the carotids before?
I haven't, but we're probably not following any people who are doing, changing much.
Well, people are
Mixed array. Yeah, they're getting medication and then following up, based off of probably limited changes outside of medication to.
Yeah, around the statins and PCSK9s, even their results like 0.04 millimeters per year reduction. Yeah, just pretty much static, right?
Yeah.
So it's more like arresting rather than reversing.
Yeah, just kind of. After the ultrasound, I showed her the plaque that was in my carotids. She goes, wow, that's a lot. That's a lot. That's really impressive.
Yes.
That's huge.
So I showed everybody. They're like, I thought I got it done a month after just to check again.
To see if that was really the same. Yeah, that's so neat. I'm impressed to see that. So got my results back. No plaque, no visible plaque. Third time I've confirmed it. The wall thickness, I didn't expect to change much because I'm normal now, 0.837. So now I'm in the 50th percentile. I went from like the 75th percentile to 50th percentile 6 months later. It is continuing to improve, diminishing returns because plaque's all gone. The wall's normal. Here it is. So I had, if you look here in the carotid artery, about 20% plaque there. And I had it in both left and right carotid arteries. And in 90 days on a low-fat diet, this was completely gone. Remarkable. Most people don't believe it's even possible. This plaque is just a symptom of your body chemistry. And when your body chemistry is inflammatory, it will start to create plaque. In fact, anybody over the age of 50, it's been shown in many studies that 85% or more already have plaque in their arteries. That means just 15% of people don't have plaque after the age of 50. Question is how much and where? If you look at this cross section, one is looking at a certain way from the side. If you look at the cross section of the artery, you also see this plaque outlined here. And then in my recent ultrasound, you'll see there's no plaque. And also, what you see is that the wall is much less thick. It's called the carotid intima media thickness test. So a year ago, my carotid wall was thick at 1.6 and 1.8 millimeters. And then at 3 months on the side, it became just 0.86 and 0.84. So it reduced about half. At 1.6 millimeters, that's worse than an 85-year-old. At 0.86, that's high normal for my age, which is 55 years old. I reduced in 3 months 30 years of vascular aging. There are 3 necessary conditions in order for plaque to reverse. This is called reverse cholesterol transport. Think of it like your plaque is in drive mode and it builds up slowly as you age. And so the older you are, the more plaque you'll get. That's why it's the #1 killer in ages 60s and 70s and 80s. But if you neutralize it, that's a rest. You're not going anywhere. The plaque doesn't grow. But if you put it in reverse, you're removing plaque. So this is called reverse cholesterol transport. And it's like you buy something and you're returning it. So it's the opposite of acquisition is returning. How do you do that? You have to put your body in a non-inflammatory state because there are these macrophages, which are part of your immune system that's trying to help you. But in an inflammatory state, it builds plaque. In a non-inflammatory state, it starts to remove plaque
and take it out of the blood vessels. This is the difference. The inflammatory state gives you M1 macrophages, and when you get rid of the inflammation, they become M2 healer macrophages. This has been shown already by a physician who was at the renowned #1 heart center at the Cleveland Clinic. This is Dr. Esselstein. He had 24 patients. Only one of them had a subsequent heart cardiac event in the next 14 years. Handfuls of them actually reversed their plaque. And the most significant one was a doctor, Dr. Joe Crow, who also worked at the Cleveland Clinic. He had 0% blood flow in his distal widowmaker, the left anterior descending. And after 32 months, just on diet alone, he had 100% blood flow. This is remarkable. And so this is the evidence that I've seen through his book and through his medical studies. Joe Crow's LDL was a mere 38 milligrams per deciliter. When I reversed my plaque in my neck, my LDL was 61, but my ApoB, which is the particle count of the cholesterol that causes plaque, that can cause plaque, was just 45, reversal territory. And my inflammation was almost 0. My CRP was 0.2, so effectively 0. And the plaque in the carotids is much easier to reverse because the blood flow is more streamlined. The blood's flowing upwards typically. The vessels are bigger. The plaque is not as old as the heart plaque. So it's a leading indicator of plaque reversal. The plaque in the heart takes longer, typically takes years. I'm on that journey. So join me in my journey. I'll show you what I did. And if you follow along, this will help not only you, but definitely someone that you love or someone that you know.